Hi, I'm Rose Kavari. I'm a urologist at Houston Methodist Hospital, and I specialize in taking care of patients who have neurogenic bladder or they have pelvic floor disorders and they need pelvic floor surgeries, reconstructive surgeries such as urinary incontinence procedures or prolapse and pelvic floor surgeries. Today, I would like to talk to you about bladder Botox injection. We're going to go over all you need to know about bladder Botox injection beforehand, during the procedure, and afterwards. So first of all, when is bladder Botox helpful? We talk to our patients about overactive bladder, and that means when patients have urinary frequency, when they need to use the restroom more than 8 times per day, or they have urinary urgency, and that means they feel like they really got to go to the bathroom. They really have no warning time. By the time they make it to the bathroom, they're about to pull their pants out or turn the doorknob, they feel like the urine is coming. And sometimes it's even too late. The urine has already started. And it's not usually just a little bit. When that urine comes, it's usually almost the whole entire bladder. That's urge urinary incontinence. Or when patients have frequency during nighttime, they get up more than twice, 3 times, 4 times, it interrupts their sleep, they can't get good night's sleep or rest, they're tired during the daytime. These symptoms are called overactive bladder. And that's when we start thinking about bladder Botox injection as a modality to help our patients. Is it common? Yes, it's actually very common. We see it up to 30% of men having any one of these symptoms of overactive bladder. And in women, we see it up to 40%. This is not a normal part of getting older. It is not normal of a part of having an enlarged prostate or being a woman with a prolapse or pelvic floor disorder. This affects the quality of life of our patients. They have to change their lifestyle. They have to skip out on the activities that they like. They have to skip out on going to the movies or trips or road trips. And it is not normal to just deal with it and accept it as a part of aging. We have many options to offer our patients. So a little bit further look or a closer look at overactive bladder. What does it exactly mean, or what do I mean by it? In a normal bladder, the bladder is calm and quiet when the urine is being collected. It just sits there. It allows the urine to collect when it's the right time, when it's the right place. You make that decision that I'm going to empty my bladder, and the bladder spasms and the urine leaks. In overactive bladder, the bladder is tight, it's spastic. And as the bladder is filling, it keeps sending signals to your brain that I gotta go. And even before it's time or it's a place for it to release, it just starts spasming to a point that's just gonna overcome the sphincter, and the urine is just gonna leak out. So that's sort of a diagram of what happens between a normal bladder and a tight, spastic, smaller, overactive bladder. Now, what causes overactive bladder? We see it commonly in neurogenic bladder patients, patients who have history of multiple sclerosis, patients who have history of stroke, Parkinson's disease, even in diabetes. In diabetes, we can have the nerves in the pelvis get affected, and that can cause overactive bladder symptoms. Patients with spinal issues such as spina bifida or spinal cord injury. We can also see it in patients who don't have neurogenic bladder. It's common with hormonal changes. It's common around the time of menstrual cycle. It's common after menopause. It's common with enlarged prostate or any other prostate diseases in men. It's common after radiation, being radiation for cervical cancer, for uterine cancer, for colon cancer. It's common when patients have pelvic floor muscle weakness or spasm. So what is Botox? How does it work? It's been around for a long time. We've been using it for over a decade. It's been FDA approved for neurogenic bladder patients with a higher dose, 200 units in 2011, and in non-neurogenic patients, 100 units in 2013. So we have a lot of good data on this medication for the bladder use. It's been used way longer than that for other indications such as migraine or other muscle spasms or is in cosmetic world. But in bladder health and bladder care, we really know how it works, what are the side effects, what are the actual effects. So we have a lot of good data to recommend it to our patients. The way it works, you have heard of it working on the muscles, let's say for cosmetic surgeries, for wrinkles in the forehead, it relaxes the muscle. So thinking about the same thing that I was discussing about the bladder muscle being so tight, the Botox injection into the bladder muscle, it relaxes that same muscle in the bladder. So again, you have this tight spastic bladder that's pushing the urine out, and you have that little nerve, the nerve ending that's telling the bladder to spasm. So after Botox injection, that nerve will be temporarily quieted down, and it would allow the bladder muscle to become more relaxed. Basically, we're taking away the wrinkles in the bladder. The bladder is going to be more relaxed, calm, it's going to have a bigger capacity, it will hold urine longer, and it would allow the patients to have time to make it to the bathroom, open the door comfortably, take their pants down, sit on the commode without worrying to lose their urine. So this is another, we've done a lot of research actually on Botox use in our patients, whether in neurogenic bladder patients or in idiopathic patients who don't have neurogenic bladder. One of the interesting studies we did is that we actually used a functional MRI, and we filled the bladder in MS patients before Botox injection and then after Botox injection. And you can see one of the important areas that manages that negative feeling of urgency, we're able to quiet it down after Botox injection. So not only it helps with the bladder nerves, but it also helps the way our brain sees those signals from the bladder. Now let's talk about the actual procedure. What would you expect the day of the procedure? Where should it be done? So usually we do this in the clinic. More than 95% of the times we're able to do it in our urology clinic in a special room. We ask our patients to come well hydrated, drink a lot of fluids before you come in, because we will check your urine, and we really don't want you to have a urinary tract infection, because if you do, we do have to postpone the procedure. So we ask you to come in well hydrated. Again, we will get you ready in our clinic, in a procedure room. It's a comfortable, large clinic. You will be on in a bed, in a patient examining bed, and we will provide some anesthesia. This will be local anesthesia. We'll put some lidocaine jelly in the urethra, the tube that you urinate from, and we'll also put some lidocaine liquid in the bladder itself. We'll let it sit for about 10 minutes or so until the bladder is kind of numb, and then we'll do the procedure. The procedure itself is actually very short. It's less than 1 minute. Most of my patients at the beginning would say that, no, we don't want to watch the monitor, we don't want to see what you're doing. But interestingly enough, most of them actually turn around and start watching the procedure with me while I'm doing it. And I can explain to them what I see inside their bladder, how we're doing the procedure. So it's extremely well tolerated. We do it for all ages, and just a small amount of local anesthesia is all that patients usually would need. If you don't want to watch a procedure, fine. Bring your iPad, bring your iPhone. You can listen to whatever music you want to listen to, watch any clips you want to watch. And here's a little schematic of how it would look like. This is the bladder. These two purple areas are where the urine enters the bladder from the kidneys, and then this is the entire bladder. So we would insert a very small scope camera that has a tiny little lens at the end of it, and we can insert a very, very small needle through that, and then we can inject multiple parts of the bladder as needed, and inject the Botox in those areas. Again, extremely well tolerated, and with very minimal discomfort, and it takes less than 1 minute in the clinic. So what are the side effects? Well, Botox is very strong. It is stronger than a lot of our oral medications for overactive bladder. In very small percentage of patients, 3% of our patients, it can work too well. It can relax the bladder too much. If it relaxes the bladder too much, then patient will have trouble emptying the bladder all the way. They can get infections, or they may need a catheter to drain their bladder. Now, this is very uncommon. It's, again, about 1 to 3% of the patients who receive Botox injection. However, even though it's such a small number of patients who can have it, we are very careful in selecting patients for Botox injection. Most of our patients will actually get an extensive workup beforehand. They may have a urodynamic test where it will evaluate the spasticity of the bladder. If the patients don't have any trouble urinating and they have a good flow beforehand, they really rarely ever experience any of these side effects, but it's something that we need to be aware of. So the procedure is done. What would you expect right afterwards, after the procedure? So you may feel a little bit of soreness in the urethra or in the bladder, maybe for 1 or 2 urination or voids. Right after that, it should wear off literally within an hour or so. You may see a little bit of blood in the urine. It should recover within, again, 1 or 2 voids that same day. And patients ask, when does it start to kick in? When does it start to work? Well, Botox does not work right away. It actually starts working within a few days, and I would say in about 1 to 2 weeks, it's when you're going to start seeing the results and the effects of it. And that's when you want to talk to your physician about your other overactive bladder medication. If you are on other medications, that's when you can stop them now, because the Botox should be starting to work and you should see the benefits of it, and you really don't need to be on all the other medications. That's the point that I actually emphasize to my patients, that Botox, when we inject it, it's local. We're just injecting it in the bladder. So really, you don't get the side effects of a systemic medication. When you take oral medications, it works everywhere on your body, on the eyes, the bowel, the brain, including the bladder. When we do the bladder injections, it only works on the bladder. So really, you don't see the other side effects that we get with the oral medication. So many patients would really want to transition to Botox because they want to come off the oral medications as soon as possible. So I would say in about 1 to 2 weeks is when you can safely come off your oral medications. Now, when would you come back for your symptom check? If this is the first time you're receiving Botox, I personally, and I think most of the physicians in our practice, would want to touch base with the patients in about 2 weeks after the procedure to make sure it's working, to review the medications, to make sure there's no infection. Also make sure you can empty your bladder okay. So we usually touch base in about 2 weeks after the Botox injection, usually with our nurse practitioner or physician assistant in our clinic. Now, how about for the repeat injection? How long does it last? I think we're very fortunate in urology. Botox lasts a good amount of time in the bladder. This is as opposed to cosmetic surgery. Patients who have received Botox, let's say for wrinkles in their forehead, they know that it wears off in 3 months. In bladder, I think we're fortunate to see that it lasts a good 6 months to 9 months, even up to a year. We have patients who just come in once a year for that few minutes of the injection, and that's all they need. They can forget about their bladder for the rest of the year. So usually I would say between 6 months to 12 months. After the first injection, that's when the patients would know when it's wearing off. And this is such a radical change or improvement in their symptoms that most of the patients would actually put that on their calendars. They will really want to come back and get their repeat injection because they see such a big difference before the intervention and then after the intervention. So usually I would say 6 to 12 months. Now I want to address some of the commonly asked questions. We get a lot of different questions from different patients with different backgrounds, and I want to address some of those here. So sometimes patients are on blood thinners. Do they have to stop them before the procedure? Usually we would consider discussing this with the patient's cardiologist or the physician who has started the blood thinner to see if it is safe to stop the blood thinner. But most commonly we have really good data that we can do this procedure safely without even stopping the blood thinner. As long as you come in well hydrated and we are very careful about where we're injecting the needle, we can avoid the blood vessels and the patients would be fine. There's a lot of good data on this in the literature that it can safely be done on patients who are on blood thinners and they can't stop their blood thinner based on their cardiologist or neurologist recommendation. How about for older patients, patients who are over age 80 years old? Can they get Botox? Would it work? It would. Actually, we have looked at our own data. We have looked at individuals over age 80 years old, and it works well. It does have similar side effect category profile, and they can see the benefit of it. So age is not a limit. This is also done in younger patients if they need it, and it's very easily done in older patients if they need it. So we just have to think about the symptoms and the patient and tailor the therapy to that individual patient. What about antibiotics? Sometimes patients ask, do I need to be on antibiotics before or after the procedure? This is really dependent on the patient themselves and their physician who's planning the Botox injection. Most of the times, no, there's no antibiotics needed before or after therapy. Now, there's certain circumstances for patients who have recurrent urinary tract infections that their physician may see a need to place them on antibiotics around the time of injection. So this needs to be individualized based on the patients. But generally speaking, no. Do I need a ride after the procedure, or can I just drive myself back home? You can. Again, there's really no need for any anesthesia except for the local anesthesia that we put in the bladder. Unless you're taking additional medications for anxiety or those sort of things, then otherwise you can drive yourself home. You really don't need anyone with you for this procedure. It's a very simple clinic procedure. So I would like to summarize our talk today, our discussion today. I would like to emphasize that overactive bladder symptoms are very common in both men and women. It can affect the quality of life. Patients can change their life activities because of their symptoms. They can skip a trip, they can skip a movie night, they can skip a date night because of these symptoms. I would encourage you to talk to your physician about it. There are many options available. We really have the power and the knowledge to tailor the treatment to patient and tailor it to their symptoms. So basically provide an individualized treatment option for overactive bladder. So if you would like to learn more about overactive bladder and how we can manage those symptoms, I would recommend you take a look at American Urology Association Urology Care Foundation webpage. It is designed for patients with bladder issues. There's a lot of good information with good diagrams and pictures in this website. You can also visit our website, Houston Methodist Hospital Department of Urology, or you can visit my research website if you're interested to learn more about the trials and the research that we are doing at Houston Methodist Hospital Department of Urology. I thank you for your attention, and I look forward to seeing you at our clinics.